Welcome to the Table for Two edition of the Deliberate Talks podcast, and I'm your host Dakshin Adyanthaya, touring you into the world of impact. And today we probe into one of the most crucial aspects of personal health. So join me as I unravel the fabric of reproductive health education with a remarkable guest, Divya Kamerkar. Divya is a visionary in the realm of digital health education and is the founder and CEO of Pinky Promise, a venture that aims to transform women's healthcare in India and make it judgment free and accessible. Apart from this, Divya has a strong experience in healthcare, public policy, and politics, and has previously worked at Britspan Group, where she helped provide management consulting services to government, non-profit organizations, and Delhi Commission for Women, where she focused on making Delhi safer for women. Today, we sit down with Divya to discuss how she's reshaping the landscape of reproductive health education with Pinky Promise. All this and more right after this short intro. And we are back. Hello, Divya. Welcome to the Deliberate Talks podcast. How are you doing today?
Hi, Dakshin. Pleasure to be here, and I'm doing really well. Thank you. Hope you're
Super.
too.
Yes, absolutely. Super excited to host you and looking forward to a lot of interesting conversations with the things that you're building up. And but before that, we have a ritual in the show, and that's a very quick icebreaker question.
Okay.
And let me start with asking you, what's that one pinky promise that you have broken in life?
Oh my gosh. I feel like with my son, I break it every single day because he's a naughty little toddler, and I think every time he's up to something and he feels the necessity to confess to me, and so he tells me, "Don't tell anyone, okay? Don't tell Papa, okay?" But of course, like at night, it's like the funniest conversation that I could possibly have with my husband, where I'm like, "Did you know what Kian did today?" So I feel like I break pinky promises with him on an almost daily basis, unfortunately.
Wow.
Yeah, but he doesn't know it as yet. He'll find out soon enough.
Adorable. That's awesome. Great. Now that we're all set for the round of questions, Divya, firstly, I'm very curious to know Pinky Promise, lovely name. Who came up with the name? What was the thought behind it?
So we actually wanted a name that sticks, something that's really easy, has no problems when it comes to recall. But honestly, the idea for Pinky Promise actually originated out of my apartment in Philadelphia when I was doing my MBA. And I was like, this is what we want to build. And it needs to be something that is confidential, that seems like a companion for women, something that they would trust, even if their best friends weren't there for them.
Right.
And so essentially we had a few names, and the good thing about doing an MBA is they ask you to test everything. So we then ran through some focus group discussions very quickly and realized that even in a non-English speaking population in India, especially with the English speaking population, Pinky Promise, they're like, yeah, it's feminine. It is something to do with protecting my privacy and confidentiality. It makes sense. And even women who are not English speaking, they really like the name Pinky Promise. It seemed
Right.
to be something that uh, caused a lot of brand recall, and so we went with it, honestly.
Okay. So I'm going to touch upon the obvious question, which 100 times a lot of people must have already asked you in terms of why you started this and stuff like that. But I'm also going to get much deeper into asking in with the views around the people that weren't sure about this concept. This is a very interesting concept. It's a must known, spoken about conversation. But there are people who will also have opinions about it. And I'm keen on knowing, were people not sure of the idea? What were the doubts that you faced when you pitched in the idea and stuff like that?
Yeah, so I think the origin story of Pinky Promise was inspired more because of a personal incident. In the second year of my MBA, I was also expecting my child, had no plans to start up at all, and COVID hit. So I was on one of these evacuation flights back to India. And after reaching, I still hadn't figured out who my gynecologist here was going to be because it was quite a sudden decision to actually come back. I started developing some complications. Luckily, being somebody who is from the city, from Bombay, who's otherwise well connected, within a couple of weeks with multiple consultations, I was able to get it completely cleared out. But in my head, I was like, why did it take a couple of weeks? Why did it take multiple consultations?
Right.
If my data actually had traveled with me, if people did not require context every single time there was a consultation, and if, for example, we were able to actually use a lot of these clinical decision-making tools that exist for the general population towards women, the number of repeat visits and the accuracy of the diagnosis could be drastically improved. So I think honestly, that's really what got me started on the journey of solving for this particular problem after having felt it. I realized that, wait a minute, there are only 70,000 registered gynecologists, a little bit up and down, according to the FOGSI, which is a regulatory body for gynecology in India.
Right.
And there are 360 million women of reproductive age in India. So apart from the fact that in general, reproductive healthcare is, very, very limited to just the delivery of a baby, and the other elements of it are kind of not yet prioritized in India, I realized that there's so much that we could do if we have a AI/ML led solution to it. And this was before generative AI really became a big boom. It was very different. Like, it was when Bayesian probabilistic systems were actually more used than anything else. And so that's when we started building. So that's the story of Pinky Promise. My co-founder Akanksha discovered Pinky Promise as a beta tester when she had a urinary tract infection. And she was, being a busy woman, really hard for her for something like this, step out of her house. Also hard to step out of your house when you're in so much pain.
Yeah.
So she actually tried out the app, and in minutes, she knew what medicines to take, what to do. The gynecologist was super nice, very friendly. And she said she wanted all her healthcare to feel like this. So she actually came in as a tech genius behind what we've built today. And join forces, and that's kind of the story of Pinky Promise.
Mm-hmm.
With respect to sort of the skepticism and everything, honestly, this is a very, very new space. Before this MedPalm and all of these other products have now come out, we said we're going to eliminate all frictions, right? So we felt like anyway, healthcare shouldn't be a frictioned experience. I come from a healthcare background, and so for me, when I saw the kind of democratization that was happening in the field of education, where you could actually just learn anything, anytime, anywhere, right? Number one. Number two, financial services in India, right? Like, it's almost instant for me to actually get a loan approval, for me to actually get money transferred to me, and for so many other savings instruments to be made available to me. Whereas healthcare, which is so fundamental to my life and death, is still a completely frictioned experience. So I think the big dream, honestly, for us is let's just make healthcare completely frictionless. And we started off with women's health. And I think people were like, wait a minute, we understand the bigger objective, but why have you started with women's health? And so there were a lot of assumptions that we needed to test out. We realized that women just don't go to a doctor, especially when it comes to their reproductive health, right? So, of course, one of this is the access barriers that I spoke to you about. It's just that there's nobody close by who could be of good quality to go to. And the second is, even if I knew that there was someone next to me, next door, I might hesitate to go to a provider because I'm worried about the experience I may have. Like, if I'm an unmarried woman, would I be asked, are you married? If I'm a married woman, would I be asked about my contraceptive usage and things like that, which is a little bit embarrassing for me to get into. All of these things, right? So we essentially realized that women actually were going online to search for their symptoms. And that gave us a lot of hope. We realized that in a given month in English alone, reproductive healthcare keywords were searched more than 100 million times. And what we did was, the first thing we realized is we're asking women who don't go to a doctor to actually now come online, come to Pinky Promise, Come online. You've never paid for healthcare services online, but we want you to come to us and pay for your healthcare service online. And we want you to trust the fact that instantly you're going to get connected to a gynecologist who's going to instantly give you a prescription for your care. All of this is going to be AI ML based. And then you're going to stick to your medication and you're going to feel better. So as you can see, that entire chain of events has so many assumptions that we
Yeah.
needed to test out. So there was obviously a lot of natural skepticism. No
Right.
one had seen this happen before. And even people who generally were supportive of reproductive healthcare and the requirement for disruption in the industry, I think they were like, okay, let's actually make sure that there's enough evidence to back what you're saying and what you're doing. Although it was more of a gut feel for us, we did everything that's required. So the first thing we did was, even before we built out an app, we actually built out a diagnostic algorithm on Excel. And we then sort of essentially went and did an A/B test where we mimicked a chatbot, copy pasting responses. We would say, what is your problem? They would tell their problem. Then we'd ask the questions. We would do that, and we realized that women were actually significantly more truthful when I was chatting and asking these questions, as opposed to even when I was calling up and being very, very non-judgmental and asking these questions. So I
Right.
realized that like a purely digital bot-based approach is actually going to work. The second thing is, we then built it all out, right? And for the past 9 months, from March to like now, essentially, we've been on an extended MVP sort of a system where, for like a very limited number of frequently occurring issues, we offer end-to-end care that is AI enabled.
Right.
And we wanted to understand, number one, like, are people paying for this? Are they getting value out of it? So what is the feedback looking like? Are we missing out on something important? And then we wanted to scale it up to everything. So I think in this past these 9 months, more than 200,000 women have actually used our services, because we also have a few free things available on our app.
Right.
More than 10,000 women have paid for consultations without almost any marketing spend from our end. And the interesting thing is, despite the fact that there were only 25, only 3 or 4 main issues that we were covering, and despite the fact that reproductive healthcare conditions like this, because we were not focusing on chronic conditions, right, like acute short-term infections and stuff for what we were focusing on, they occur maybe once in a year for a woman.
Mm-hmm.
Still, for those who had it more than once, 25% of people who actually paid came back to us to consult. So we realized that, okay, this is working very well for us. The third thing we realized is, even after women get their medicines, right, they have thousands of questions that they want to ask the doctor. This is actually their first point of contact. They're like, I got my medicines. Wow. Now I want to ask about like every single thing under the planet. We did not have a mechanism for that. We were doing it manually in the beginning. We were just arranging calls, and it was overwhelming us. So we actually built a chat GPT based co-pilot for our gynecologists, so that even after the medicine goes out, the gynecologists can continue to provide real-time responses, and they would be assisted by a really nice system for empathetic, accurate, and proper responses that we would train based on our data.
Right.
So honestly, like, we had to test out all of this, and finally I feel like we're in a point where we're like, yeah, all of this is working, let's scale, because 91% of women who've actually taken consultations with us have reported feeling better and have come back within sort of that adherence period to report to us that, yeah, we started our medication. So honestly, because that's what matters, right? Like, if you're eventually building a healthcare platform, you want to make sure that the outcomes are improved. So that's the whole chain of events. And obviously there's going to be a lot of skepticism, but I feel like it's up to us to, especially as category defining or as first movers, it's up to us to actually disprove that and say that we understand that there are a lot of questions, but here's how we're tackling them.
Right. This amazing thing that you touched upon, when you have this conversation of skepticism with, say, a school level program, or someone, this is required in a school level program, I'm assuming. And it's when you go to schools, when you go to education systems, I think schools are also very skeptical about having a conversation like this very openly with their students, right? Do you face such skepticism also, or like is it like they're welcome because it's technology now being integrated to it with the whole system of ChatGPT and the curiosity building and coming into the picture?
Yeah, I think it's a trickle-down effect. I feel like what we are noticing is that individuals themselves, young women, they are proactively seeking out these kind of services,
Correct.
right? So we thought about like what is the best way to go to market. Do we go through institutions and schools and companies, or do we just go D2C?
Mm-hmm.
Um, and for us, the D2C has just been like crazy good for us, right? Like our customer acquisition costs are like incredibly low because what we realized is women are already searching for their symptoms
Correct.
online. Like if a young girl has just gotten her periods and her school is not providing her the right resources,
Correct.
of course, in areas which are internet enabled, she's online. She's
Yeah.
searching for what to do to manage my menstrual cycle. And the good thing is, because Pinky Promise is the only platform that is providing you an instant answer that is provider driven. Um, it's a very easy way for us to acquire people by just being there when people are searching for their symptoms. So what we realized is then it's like, oh, can you come to my college and do this workshop for my college? Because people from certain colleges have actually used Pinky Promise, right? And so we get invited into colleges to actually like then talk more about our product and spread it further. But it's interestingly largely not been institution driven, this initiative. Only because I feel like people who are studying in these institutions are becoming super proactive and are doing things themselves and want to take care of themselves. There's a very interesting study by the Pew Research Center in Internet and Society in America, and it actually shows that women are more likely to read long form health articles about themselves and about health issues more than men. And so I think that desire to actually care for oneself and get better is certainly improving over generations. We didn't see that in our mothers and all that because unfortunately what we would see was our mothers would, for example, always deprioritize their health, right? Like they would always have this one headache, one backache, mere pair dukh rahe hain, and they would take all of us to the hospital, including the pets, but not themselves. But I think we're now seeing a growing generation of women who are prioritizing their healthcare and their well-being first, and they're leading like the adoption of things like Pinky Promise to society.
Lovely, lovely. Okay, just continuing the conversation of skepticism again. Now, coming from a user perspective, right? They are very, very skeptic about the whole aspect of privacy and conversation within the app, the data, right? Building trust is very crucial. How are you dealing with this side of skepticism?
Course, I mean, rightfully so. People are skeptical, people are scared about their data.
Okay.
I think there are two ways to do it, right? From a theoretical standpoint, there's a top-down approach and a bottoms-up approach. That's how I like to think about it. So the top-down approach is spend a lot of budget on building trust. You basically have, people who are trustworthy to serve as your brand ambassadors. You go to every online and offline marketing source. You plaster everything available with, come to Pinky
True.
Promise. Make it really attractive, and people, and as long as the product is good, it spreads really quickly. That's one way of doing it, but what we chose was actually the bottoms-up approach to building trust. It's much harder, but I think it's fundamentally required for you to then be able to scale. And what we did was we said that every single person, every single step of the way, we need to reinforce trust. Person who has a healthcare issue would rather not have a healthcare issue. So they're also not only not trusting your platform, but they're also, let's say, disenchanted customers at the outset because they don't want to be consulting a doctor. They don't want to have a healthcare problem. They don't want to say they have an issue, right? So it's actually a really hard problem to crack. So the first thing we did is we made sure that the way we were acquiring people, which was through our information, was extremely trustworthy. So that was the first step on the way. So we write a lot of articles on our website that are all provider written. We also, and it's all done in-house, right? So it's very cost effective. The second thing is, if you can see our social media, it's full of really informative content that's very relevant to the target audience. And so that way people are like, okay, I trust this information, maybe I'll click on the link. But once we click on the link and use our app and platform, we focus on making sure that every single thing that we do along the way is clear, transparent, and friendly. Everything from the choice of colors to illustrations of brown women on our app that are actually like seeking healthcare, right? and to the way that we ask questions. We make sure that we are reinforcing very subtly that this is a non-judgmental and safe platform. And where we are asking for information, there are a lot of disclaimers to make people understand why are we asking this in the first place. So, for example, according to Indian telemedicine practice guidelines, we do need to verify identification, right? So,
Right.
it's obviously like, why are you asking me for my identity? Are you going to tell my parents about it? Interestingly, it's not a question of is the data stored securely, but it's like, is my family going to know about it? Like,
Correct.
that's actually, unfortunately, the bigger problem
Mhm.
that we are facing. So, we make sure we clarify how we deal with your data. How is it securely stored? How is it maintained? All of that stuff, right? And so we're very, very clear. And the best part is the payment actually comes after you answer your questions to the doctor. So
Right.
it's only when we know you have a problem, you do require a medicine for it or a prescription for it, that you end up paying. And by then, the trust is reinforced.
Right.
So we actually have a 2% drop off between people who fill our questions and pay. And the only way we're able to do that is through all of these UI, UX, repeat prototyping and testing and improving the product to make sure that it's a trustworthy platform. And of course, I think we also have to put our money where our mouth is. So
Mhm.
we do, and Akanksha is really responsible for this, but we do prioritized heavily the data security and our data architecture to make sure that there's the vulnerability is as minimal as possible. There's no risk of breach. People's data is safe with us.
Right.
So these are all things that we do focus on.
Right. Right. There's an interesting article I read where there's an instance where you have mentioned that there's a small percentage of dropout in terms of or uninstallments of the app, right? How are you catering to this problem in terms of regaining? Because obviously it must be a shared device, or they're not sure after the first service, or they for now don't want to use the service. How do
Yeah.
you ensure that this kind of thing is bridged together?
I think two ways. It was
Uh-huh.
an interesting thing for us to realize, and what we were concerned about was it because of poor quality of service?
Mm.
Um, Good thing is that it was not because we actually called all of these women and we were like, we
Okay.
just want to know what happened. In fact, in the course of this 9-month period, we must have spoken about 50,000-60,000 women.
Wow.
So we want to make sure that we actually understand what's going on as opposed to just relying on. I mean, of course, we use the numbers to figure out what the problem is and then we try to diagnose it, right? But all the women that we spoke to said that no, thank you. This was a fantastic service. But I don't want someone to find out that I'm on Pinky Promise. And then we're like, are you on any dating apps? Do you do the same with dating apps? They're like, yeah, we do the same. It was an interesting question to ask, right? So what we realized was because we were focusing on one-off conditions. The minute that the woman is like, okay, I now know my medicines, I have already chatted with the doctor, all my questions have been resolved, I feel better, there is a likelihood of an uninstall happening at that point of time. So there are two ways that we have fixed it. Number one, 40% or upwards of women who actually come with one-off conditions also discover chronic conditions on our platform.
Right.
I mean, polycystic ovaries is of course something that is
Right.
very prominent in the Indian genome. The second thing, of course, are issues like just thyroid concerns,
Right.
menopause, pregnancy journeys, postpartum journeys, and in general, like it may not be polycystic ovaries, but it could be hormonal disruptions, cycle disruptions. Dr. Reema Shah, who's our medical director, has about 15 years of experience exclusively focusing on these issues because well before polycystic ovaries became like a buzzword, a decade ago, she actually set up her own practice focusing on PCOS. So she has that experience of actually working on reversing the condition in thousands and thousands of women, and now we're actually scaling that up on our platform.
Yep.
We're using AI to actually make you feel like you're constantly connected to your provider and your nutritionist. We're using a lot of background data so that it's very seamless. You don't have to come every day and tell us, okay, what did you eat? What did you do? All that stuff. It's if we detect something is wrong, we'll reach out to you. But that way, like women with chronic conditions will continue to actually remain on our platform on a subscription-based system so that we are able to effectively retain them. And the second thing is we actually built out and released a period tracker, which is being used by about, if I'm not mistaken, today there are about 35,000 women using our period tracking service, and we only launched it a few months ago. And now, in fact, we have learned that to get even more women, it's important to move away from the standard format of this period tracker that we are all so used to seeing and use something that's a little bit more intuitive and chat based to get the information. So we're hoping that with these two things, we'll be able to significantly increase the retention and the repeat visit rate so that people don't uninstall. Interestingly, Dakshin, even women who have uninstalled the platform, they are actually able to come back to us the minute they have a reproductive health issue. And we're also launching a web app, which means that uninstall and needing to install something to be able to access it is no longer going to be a fiction or a requirement for you.
Right, right. Super. You also mentioned a small part of subscription as well, and I'm very keen on knowing this. There's a 50 rupees basic charge, if I'm not wrong, as well, right? Yeah. So, considering the demographic challenges, the cultural curiosities, and also considering, they're already skeptical about whether going on an app and, is this genuine or building that kind of trust for the very first time, right? Uh, would you think a free app, like you did mention, there are certain services which are for free in the app, but would you think the free aspect of it would pull in more accessibility, or do you think this is to restrict the number of spams or for the sake of people coming in and asking questions? What was your thought there?
I think there were two things. So we've actually interestingly increased our pricing. So it's not 50 anymore, it's 99 rupees. Because we did a lot of studies on what is the level to which people actually consider this payment to be something that's worthwhile, but also reduces drop off significantly. And we were able to arrive at this number.
Right.
And before, I think one of the reasons why we're able to, in fact, price it so low, on average, if you're in a big city, in-person gynecologist consult is about 1,000 rupees at least, with a good one. And the kind of gynecologists we have on our platform are those gynecologists. They're like, actually, if you go to one of their clinics, you're going to have to pay that much money anyway. And we make sure that we bring on really quality providers onto our platform. But at the same time, we're able to price it so low because at the end of the day, our technology does most of the work. And it disrupts and enables our gynecologists to then focus on curing that patient, focus on the care part, as opposed to the investigative element.
Okay.
And that really, really reduces the cost. And it costs us, and we've built such a light backend that it almost costs us nothing to run that n number of times for our customers. And so in fact, more than any other telemedicine platform where you have to share revenue for each and every consult with a gynecologist, we don't actually do that. And that enables us to retain all our earnings. The second thing is we decided to price as opposed to be very honest with you, with a lot of the income streams that are now going to be launched, and you'll see that soon. Something like one-time payments for a healthcare service is not going to be what 5 years down the line contributes in a large manner to our bottom line as a business. So sure, in the future, maybe we could have thought about a reality where all of this is free. But the reason why we didn't do that is twofold. The first is if you look at the psychology of a customer, right? This is healthcare we're talking about. And we eventually want people to actually take this very seriously. We want to make sure that you realize that what you're getting is an actual gynecologist's time, an actual gynecologist's thoughts that have gone into figuring out what medication you need to take and what you need to do to get better. And your getting better is valuable for us for you to come back to our platform, right? And so we priced it at 99 rupees because we realized that it's low enough that women who've answered these questions and have come onto our platform are like, yeah, okay, yeah, this makes sense. I'll test it out. I'll try it. It's not a big deal. I can take that leap of faith. But at the same time, it is meaningful enough that they don't consider this to be kuch bhi, like it's a free thing. And so, interestingly, there's a lot of public health literature out there in terms of malarial nets or, soaps for hand washing and stuff like that, which actually say that giving something out for free is more effective in terms of uptake. But what we've actually seen is when women are able to value what the fact that they're paying for something, they take it far more seriously. Like
Correct.
the amount of, because we guarantee instant responses. If there's a technological issue and a delay, the amount of women who call us immediately and tell us that I paid and this is delayed is very, very high. Not a good situation for us to be in.
Right.
But it's basically reaffirms what we thought of. The second thing is we are a disruptive player, right? Like the reason that we've priced it so low is because we don't think fundamentally that as a business, we don't think that out of pocket payments by individual women for their healthcare should be what drives the healthcare industry and by people, right? And that's what's happening in India today in the private healthcare industry.
Right.
So if you're actually going to be a business that completely disrupts it, like this is the way to go. And so that's how we thought about it as well. And we want people to be like, did you know that for 99 rupees only, you actually get the best care and it's better than anywhere else that you could go to. That's the mindset that we want. And as I mentioned, we were at that point where the bottoms up stuff has worked really well and we want to scale the top down approach.
Right.
So I think now is when we are expecting in a few more months that people start really talking about this. And if you look at our Google Play reviews also, a lot of women have mentioned this. They're like, I cannot believe that I got such an amazing service. Like, and now I'm going to tell everybody about it. And these are all completely organic. Like loads of people have just gone there and written all
Right.
of these things.
Right.
So yeah, that's honestly why we chose this sort of a pricing strategy.
Lovely. Great. And your app also has content in Tamil, Hindi, and Marathi besides English, right? So what was the thought behind it? Why did you come up with multiple languages? Obviously, because of the cultural and demographical representation of your TG, but why is it a necessity that you saw to launch, the different languages, and what other languages are in process also in, your future timelines?
So, this question on languages is very, very interesting. And I think the way that we thought about this was we knew for a fact that if you want to be a mass market driven solution for healthcare in India, for women, you can't stick to English alone.
Okay.
Two reasons. Number one, of course, the population that speaks it, they could be like your starting market, but they're definitely not going to be the market that eventually drives the millions and millions, right?
Okay.
Number two is just from a reality check standpoint. We are women in the cities building something, right? And the way people access healthcare outside of the cities is so different. Like I've actually lived and worked in Bihar, in rural areas, in Tamil Nadu, UP. And what I realized was when it comes to reproductive healthcare terms, using English to ask these questions just doesn't make any sense.
Okay.
But at the same time, it was complicated because women don't use proper words to describe their reproductive healthcare, body parts to describe their reproductive healthcare cycles, nothing, right? There are so many euphemisms. Meri mahine ki dost aa rahi hai is what a lot of people say. What does that mean? Your periods are coming, right? If you use a word like menstruation, most of India is not going to understand what that means, right? So I think it was a big challenge and we were a bit hesitant to step into it. We thought English is working, the fidelity of the responses is high. Let's scale this up and then focus on other things. But what we realized is like as we scaled, 70% of our audience was coming from tier 2, tier 3 and smaller demographics.
Right.
And they were all chatting in English. And so we first translated the app into English and not Hindi and not any pure language. We actually used English and we translated the app. This was done internally. And then USAID, so we're actually a part of this program where the Momentum, a global partnership of USAID with Japago and Wilgo, they actually have funded us and they support us. They insisted, they said, you know what, this is actually going to be very important for you as a business. We'll help you we'll provide technical assistance. We'll actually sponsor the whole effort to translate the app. And so we got a really good organization to work on translating into Tamil and Marathi in addition to English because these were two large pockets where our users were coming from, in addition to the Hindi belt. So we did that, we piloted it and everything, and now we've actually learned a lot from it, like user-generated feedback on how this process is working.
Right.
And interestingly, when we're actually in the process of just launching a completely revamped and complete version of our app. In that, interestingly, it's only going to be starting with English because we've learned so much over the process of translation that we want to actually build a very scalable framework for translation. Going language by language by language is not scalable. And so we have a few tricks up our sleeve to make sure that it's scalable, but also medically relevant, medically understandable. And in a couple of months, it should be available in not just these three languages, but in a whole host of vernacular languages.
Right. Right. Just curious again, when you know, say someone from Tamil Nadu types in English or types in Tamil but in English, right? The Tamil words in English, uh, or even short forms of each word. How do
Yeah.
you really try to understand the language and perceive?
Yeah. So there are two things that we have done. So we only match people speaking certain regional languages if they've actually chosen that platform. We match them to the providers that know those languages. So that also constrained our choice of language, obviously. But luckily, thanks to India being such a diverse landscape, we were able to find quality providers in all of the languages.
Right.
But I think what we did was that was one constraint. The second thing that we did was when it came to the initial intake of symptoms and medical history, we constrained the responses because of this problem. Even people who start out saying English is my language, they will break off into a regional thing in the middle of describing their problem. Right. So if I had a free flow chat system where it's like, please describe what issue you're facing, you will get paragraphs from women, and we've actually tested this out, and we have so much data which we're actually now using to train a bot to understand that intent really well.
Right.
We first wanted to focus on the medical components, right? So we constrained response and we enabled but we also made sure that the choices available were as easy as possible, right? So there were as many choices available over there. And we went through an extensive pilot with more than 10,000 women to make sure that that was the case, and continue to iterate it. So thanks to Akanksha, the minute we know that we need to change a question, we change it live. Like it's very easy and it's carried forward, right? So it's very easy that way. But we did all of that to make sure that initially your symptom and medical history intake is constrained and that confusion doesn't creep in. But when it comes to the chat, the free flow chat with the doctor, once you get your prescription, we did not constrain that at all, purposely to learn. And so that's how we've been training our system. With a lot of the way that people actually describe it. The good thing is these LLMs are actually really good with Indian regional languages. So we're actually not, as long as we train with the right, we do the right amount of training and fine tuning, we should soon be able to launch something where instead of these constrained responses, women can just actually have a natural experience. They can type out their problems in great detail, and only what's missing, the intent will be understood and confirmed, and only what's missing will actually be asked in terms of what else is required in the medical protocol to be able to diagnose you. That's a much more effective system.
Yeah. Absolutely. Absolutely. Wonderful stuff there, Divya. That brings us to the end of the first round of questions. And now I'm going to move into the last round of questions.
We did. All right.
This is the last round of questions, and this is the rapid fire round. And this is the time to pace up our conversation. So, ready for some fast paced questions coming at you?
All right, I'll try my best. Let me see.
Super.
Cup of coffee. All right, I'm ready. Let's go for this.
Lovely. In 60 seconds, give me 3 reasons why one should download the Pinky Promise app now.
It's extremely convenient. It's completely judgment free, and it works really well at a very low cost.
Super. In 50 seconds, 3 advices for women in STEM aspiring to be health entrepreneurs.
I think the first advice is do not limit yourself. STEM is honestly the best field that I've had the joy of sort of studying, and it's just there's so much you can do. The possibilities in STEM today are just limitless. They've always been. So don't limit yourself. Number 2, find the right mentors. Especially women in STEM, right? Like make sure that you have senior women in STEM who are advocates for you, who are the right mentors. And number 3, keep learning. Like STEM is a field that's constantly advancing, that's constantly improving. There's so many research papers of high relevance that are being pushed out every single day. Take time in the morning where you can actually do that learning and reading, which is completely unstructured, not necessarily pertaining to your work, but pertaining to what you're interested in.
Super. Okay. In 40 seconds, three most amazing feedback from Pinky Promise users that you've received.
I think the first was, wow, this is the best ever. I am telling my entire family about it, and her mom actually did consult with us for her menopause problems. The second thing was, this prescription is so neat and clean, I can't believe I understand it. Which is nice because I did typed out prescription. And the third one was, thank you for asking me more questions and easier questions than I've ever been asked in my life. I was really ashamed to go anywhere and consult, but Pinky Promises made it easy for me.
In 30 seconds, three reproductive health myth you wish to debunk.
The first is that there's no specific food that actually causes you to either get your periods early or get your periods late. Like that doesn't work that way. And a lot of women have that question actually. They wonder if I ate cucumber, now I'm not getting my periods, or I got my periods, but I want to change my cycle, so can I have ginger water? I mean, there's no scientifically proven study that actually demonstrates causality. The second thing is you vaginal discharge is normal. A lot of women actually think that it's not normal. It's only when the texture, the color, the smell, the feel changes that you need to actually come and consult somebody about it. I think the third thing is a 28-day cycle is not for everybody. The minute that a woman actually, some people can have genetically shorter or genetically longer cycles, and that's just okay. The fourth thing is a lot of women actually feel that the oral contraceptive pill, the birth control pill, causes infertility. As long as your medical history is cleared for taking the oral contraceptive pill, there's no such thing. There is a return to fertility that happens in a few months after you stop the pill. It's helpful for long-term preservation of your own birth control plans and stuff like that.
Okay, great. In 20 seconds, biggest challenge while developing the Pinky Bot.
Oh God, this is a hard one for rapid fire. That's 20 seconds. I think for us, it was the technology at first. We were trying to ensure that our AIML was based off of the right medical protocols, and we trained it on 250 plus medical protocols. So fine tuning that and making sure that it's proper for somebody to actually use is important. And even till date, nothing goes out to the customer without the doctor verifying the information. The second thing I just wanted to say is, more than the technology, honestly, getting people to use the platform and trust it is honestly a bigger challenge, right? So that's also something that we faced initially, but I feel like we've figured out ways and means to completely tackle that now.
Oh, lovely. And finally, in 10 seconds, your favorite health app besides Pinky Promise.
I really like Healthify Me. I love what they've built. It's a really nice app. And kudos to them for actually being super tech first. I'm glad to see that there are such big companies that started well above us, before us, that are so tech first when it comes to their healthcare. It helps the industry, it helps investors sort of have faith in other applications that do that. Yeah.
Right. Fabulous stuff there, Divya. That brings us to the end of today's show. It's just amazing to hear your journey and how you're revolutionizing this entire space of conversation around reproductive health. Thank you so much for this valuable conversation. I thoroughly enjoyed hosting you. I hope you had a good time on the show too.
Oh, I had a great time. Thank you so much. It's lovely to actually go and answer these questions when we're so focused on building, to actually think back at, oh wow, what was that like, was very helpful. So thank you so much, and pleasure to be on your platform.
Thank you. Thank you, Divya. Thank you. And wishing you and Pinky Promise nothing but the best for the future.
Thank you so much, and likewise. Thank you. Take care. Bye bye.
Bye. And with that, we come to the end of today's episode. Don't forget to subscribe to all the audio and video channels of the Deliberate Talks and Pixelated Egg Digital Ventures. Join in next week for a Table for One edition. Until then, be curious, be adventurous, and never stop learning. Cheers.